Bismillahirrahmanirrahim. Assalamu alaikum to all my viewers and students. Today we are going to learn about the antacids. So, we already have discussed the antacids, and I will put the link in the description, the classification of the antacids. Now we will discuss in details about the antacid. What are the uses of the antacid? Antacids are used for the dyspepsia. What is the dyspepsia now? Dyspepsia is the feeling of indigestion, feeling of fullness and burning. It is the dyspepsia. And antacids are also used for the acid peptic disorders. Okay, so there are the two main uses of the antacid. Number one is the indigestion, which and the feeling of fullness and burnings, which is not associated with the ulcer. Second, the use of the antacids are the acid peptic disorder, like simply the secretion of the acid or hypersecretion of the acid in your stomach. But now they are replaced largely by the H2 receptor antagonist and proton pump inhibitor. However, still used by the patient for the treatment of intermittent heartburn and the dyspepsia and for the pain relief, because they some people have the mindset of using syrups. The most important thing about the antacid are they are available in the syrups. Although the proton pump inhibitors are also H2 receptor antagonists are also available in the suspension form, like famotidine is available in the suspension form. However, most of the people prefer the use of the antacid because they are available in the syrup form or the suspension form, and they provide rapid relief. Okay, they do not want to go for the long for the medication or the tablets or the pills. Okay, so what is the action of the antacid? Antacid the one most important thing about the antacid is that they have the basic nature. They are the alkalinic in nature. These are the weak bases, and the gastric acid is the acidic in nature. Obviously, as the name indicates, it is the acidic in nature. So acid and base interact, and we all know that when the acid and base interact, it will lead to the reaction that will form the salt and water. Okay, so this is the main mechanism of the antacid. Okay, now when to take the antacid, this is very important thing. What is the time of administration and when to take the antacid to have the proper effect of these agents. After the meal, one very important thing is that when the acid is present in the body, then and you give the salt, then it will react. When the acid is not present in the body and you give the base, then there will be not that much effect. Because the reaction will not occur as that amount of the acid is not present in your body. And after the meal, most of the people and another important thing is that after meal the acid secretion increases, and then the people have the symptoms, and then you need to give the antacid. So it is given after the meal. So after the meal, 45 milliequivalent per hour of the HCl is secreted. 45 milliequivalent. So single dose of 156 milliequivalent of antacid given after 1 hour of the meal neutralizes the acid up to the 2 hour. So this is very important. These values are very important, that single dose of 156 milliequivalent of antacid given after 1 hour, because when you are taking the food, it takes time to go from the stomach to the intestine. Almost it is said that it takes almost 2 hours to go from the stomach to the intestine, small intestine. So you need to give the antacid after 1 hour so that it produces its maximum effect. So it is given after 1 hour of the meal, and it neutralizes the acid up to the 2 hour, like it keep on neutralizing the acid. Okay, so this is the second most important thing. Now comes to what the acid neutralizing capacity. Acid neutralizing capacity is different for the different drugs. It depends upon the rate of dissolution. Tablet versus liquid. Liquids are more easily dissolved, obviously, because they get mixed, they get miscible. Tablets take time. Second is the water solubility. Third is the rate of reaction with the acid. This is also very important, and we will see that the agents that come under the class of the antacid have the different rate of reaction. Third, and the fourth one is the rate of gastric emptying. What is the rate of gastric emptying? It is also very important. The drugs that classified as antacids. Number one is the sodium bicarbonate. It is very important, and we all know by the name of the baking soda. We all know about the sodium bicarbonate since we were in the matric as by the name of the baking soda. It is also come under the brand name of Alka-Seltzer. Okay, so what is the reaction? What is the reaction that sodium bicarbonate performed or do with the acid? Sodium bicarbonate NaHCO3 react with the HCl and form what it forms? Salt, NaCl, water, as we see salt and water. And the third thing is the carbon dioxide, and this is the main side effect of this agent. Main side effect is the release of the gastric distension due to the gas and belching. But now what is these agents? Number one is the release of the gas due to the carbon dioxide production. Second is the NaCl. NaCl is absorbed as it is a salt, so Na and Cl are absorbed, as we have discussed in our diuretic lecture, that sodium and chloride both get absorbed, and it increases the fluid retention in the patient with the hypertension or the renal insufficiency. So fluid retention increases because water follows the electrolytes, and as the sodium and chloride absorb in the body, the water also move behind these ions, and the water retention or the fluid level in the body increases. So it will create problem in the hypertensive patient or heart failure patient or the patient who have the renal insufficiency. So this is the second main side effect of this agent. The production of the carbon dioxide is common to all. However, CL is more problematic in the hypertensive, heart failure or renal insufficient patient. However, it does not create as such problem in the normal patient or in the normal cases, the patients who are not suffering from these conditions. The third one is the unreacted alkali readily absorbed, like NaHCO3, sodium bicarbonate itself, without being reacted, it get absorbed readily, and it causes the metabolic alkalosis when given in the high doses or to the patient with the renal insufficiency. So it is also has two conditions to produce a side effect. Number one, when it is given the high doses, or when it is given to the patient who are renal insufficient. So the main problem is the production of the carbon dioxide or the gastric distension. The other two problems are occur in those patients who are renal insufficient or who are hypertensive, or when this drug or this agent is given in the high doses. Okay, so now this is the clear sodium bicarbonate, and the sodium bicarbonate is also available in combination with the proton pump inhibitor. This is very important, that sodium bicarbonate is available in the combination with the proton pump inhibitors. Okay, so now comes to what the calcium carbonate. What is the calcium carbonate and how it produces the its effect as an antacid? It also reacts with the HCl. However, its reaction with the HCl is slow than the sodium bicarbonate. As we have discussed, the acid neutralizing capacity, it also depends upon the rate of reaction with the acid. If the rate of reaction is slow, then the acid neutralizing capacity is less. Okay, reacts slowly with the HCl, then the sodium bicarbonate, and it also forms carbon dioxide and calcium chloride. Also causes the metabolic alkalosis because it also get absorbed, it also produce belching, and it also causes the metabolic alkalosis. Excessive dose of these antacids with the calcium containing dairy products, products or the dairy products, like simply calcium containing products or dairy products, it causes the hypercalcemia because it contains the calcium, and it specifically create problem in the renal insufficient patients. It can also cause the renal insufficiency, and it also can cause problem in the renal insufficient patient. It causes the syndrome which is known as the milk alkaline syndrome, because why it is called milk, because it raises the calcium level, and milk also has the high calcium content. So the name indicate milk alkaline syndrome. It means that it is from the calcium carbonate. Somehow it links with the calcium carbonate. If it come in the MCQs that which agent causes a milk alkaline syndrome, the answer should be related with the calcium, and it is the calcium carbonate. Most potent and may cause constipation. Toward the third agent, which is the most widely used agent, which are the they are, as they come in the combination, so I will say which are the most commonly used agent in the practice. They react slowly with the HCl. Although they react slowly with the HCl, produces the magnesium chloride and aluminium chloride and water. So there is no production of the gas, no gas is generated. And alkalosis is also uncommon because of the efficiency of the neutralizing reaction. Alkalosis is also uncommon. Unabsorbed magnesium salt causes the osmotic diarrhea, and aluminium salt causes the constipation. Okay, so this is very important. Magnesium causes diarrhea. Magnesium, that's why milk of magnesia is used to treat the constipation, because it can causes the diarrhea, it can causes the movement of the stool from your body. Okay, so that's why milk of magnesia we have discussed in the laxative lecture, that it can they are used as a saline laxatives. So magnesium containing salt, so magnesium salt causes the diarrhea and aluminium causes the constipation. Alone they are not really efficient, especially aluminium containing antacid are the weakest, have the weakest acid neutralizing capacity. So both magnesium and aluminium containing antacid are administered together in the formulation to avoid the bowel movement. So they are come under the brand name of Digex. Along with the very important, okay, I will tell you about this one important thing in this combination, but for first we complete this lecture. Both these are excreted by the kidney, so they are avoided in the renal insufficiency. So in other words, all these three antacids are prohibited or contraindicated in the renal insufficiency, as all the antacid affect absorption of the other drugs and the gastric pH. Obviously they affect the gastric pH because they cause neutralization reaction and the acid level decreases. Therefore antacid should not be given within the 2 hours of the doses of the tetracycline, fluoroquinolones, itraconazole, iron and digoxin. These are very important points, that the fluoroquinolones, itraconazole, iron, especially iron supplement. Sometimes people take iron supplement and after that they take milk. This also called milk. Milk obviously also has basic properties, so it also causes the decreases the absorption of the iron. Fluoroquinolone, the absorption of the fluoroquinolones decreases because they form the complex with the iron, because they form complex with these antacid cations, with these antacids. So the bioavailability of these drugs decreases. I have discussed in the lecture of the drug interaction, when we discussed the drug interaction from the comprehensive pharmacy review. In that lecture I have told you how the pH is affected by the drugs and how the drugs are affected by the pH. These both sentences are different. How the pH changes with the drug and how the drug level changes due to the pH. So tetracycline, fluoroquinolone, itraconazole, iron and digoxin should not be administered within the 2 hours of the antacid. Now one very important thing is that these drugs, as this drug causes the production of the gas, so there must be some agent that remove this gas as well. Or if the patient is having the feeling of indigestion as well as the having gas or the belching problem, what will you give to that patient? You will give simethicone. Okay, you will give simethicone. So the agents or the syrups that contain simethicone in them are very best to treat these all indigestion symptoms. Like the syrups that are available are the Digex. I have told you it contains simethicone, and the man acid, this is also the suspension, it also contains simethicone to remove the gas from the stomach. So these agents are very important, and these practical points are very important to practice in the when you come in the field. These points should be in your mind. And this okay, so if you have any question, any query about this topic, you can ask me in the comment box, or you can contact me through the Facebook page. Until next video, Allah Hafiz, share it to your friend and subscribe to my channel.